Whether or not we believe they are the windows to our souls, our eyes are certainly one of the first things people notice about us. But no matter how attractive our eyes are, drooping skin immediately above or below them works against us, making us appear chronically tired or much older than we are. That's when blepharoplasty, also known as cosmetic eyelid surgery, can help. Normally performed as an outpatient procedure, blepharoplasty can significantly impact a person's appearance, making their eyes appear larger and giving their face a more rested, youthful appearance. Upper eyelid surgery can remove excess fatty deposits that appear as puffiness in the upper eyelids. Loose or sagging skin that creates folds or disturbs the natural contour of the upper eyelid, sometimes impairing vision, can be treated by eyelid lift surgery. Lower eyelid blepharoplasty can remove excess skin and fine wrinkles of the lower eyelid. Bags under the eyes can be corrected by blepharoplasty. Lower eyelid surgery can correct droopiness of the lower eyelids, showing the whites below the iris. A blepharoplasty procedure is usually performed on adult men and women who have healthy facial tissue and muscles and have realistic goals for improvement for their upper and/or lower eyelids and surrounding areas. You should undergo blepharoplasty surgery for yourself, not to fulfill someone else's desires or to try to fit any sort of ideal image. Good candidates for cosmetic eyelid surgery are healthy individuals who do not have any life-threatening illness or medical conditions that can impair healing, non-smokers, individuals with a positive outlook and specific goals in mind for blepharoplasty, individuals without serious eye conditions. You must tell your doctor if you have any of these medical conditions: eye disease such as glaucoma, dry eye or detached retina, thyroid disorders such as Graves' disease or under or overactive thyroid, cardiovascular disease, high blood pressure or other circulatory disorders, or diabetes. The success and safety of your eyelid surgery procedure depends very much on your complete candidness during your cosmetic eyelid surgery consultation. You'll be asked a number of questions about your health, desires, and lifestyle. Be prepared to discuss why you want the surgery, your expectations and desired outcome, medical conditions, drug allergies and previous medical treatments, use of current medications, vitamins, herbal supplements, alcohol, tobacco, and drugs. Your surgeon may also evaluate your general health status and any pre-existing health conditions or risk factors. Take photographs for your medical record. Discuss your options and recommend a course of treatment. Discuss likely outcomes of eyelid surgery and any risk or potential complications. Discuss the type of anesthesia that will be used. Eyelid surgery risk and safety information. The decision to have cosmetic surgery is extremely personal, and you'll have to decide if the benefits will achieve your goals and if the risk and potential complications are acceptable. Your plastic surgeon and/or staff will explain potential eyelid surgery complications in detail. You will be asked to sign consent forms to ensure that you fully understand the procedure you will undergo and any risk and potential complications. Unfavorable scarring, temporary blurred or impaired vision, dry eyes, difficulty closing your eyes, lid lag, a pulling down of the lower eyelid may occur and is often temporary. Ectropion, rolling of the eyelid outwards, bleeding, poor wound healing, infection, fluid accumulation, blood clots, numbness and other changes in skin sensation, anesthesia risk, eyelid disorders, pain which may persist, skin discoloration and swelling, Sutures may spontaneously surface through the skin, become visible, or produce irritation that require removal. Deep vein thrombosis, cardiac complications, possibility of revisional surgery, loss of eyesight. Since each person's features are different, your physician is the best source of advice on which procedures might be right for you. Ask your physician about blepharoplasty and open up your eyes to the possibility of a younger and more attractive appearance.